two steps. When you are doing the laser, first you make a flap in the cornea. Like you have a door, you have a hinge. So you make a hinged flap and then do the laser in the meat of the eye, that meat of the cornea, that means on the corneal stroma. Put back the flap heals and it attaches to the undersurface on its own. So no stitches required, nothing required, but you are making a flap, and this obviates the need for burning the cornea from the top. If you are burning the cornea from the top, the epithelium burns, so you get pain and discomfort. But in LASIK, you are first making, it's a two-step procedure. You are first making a flap and then reshaping the cornea with the excimer laser. Now, this flap was earlier made with a blade that was called as a microkeratome. Micro means cutting at micron level. Keratomes mean cornea. Tome means to cut. So you used a blade keratome to make this flap. Now, the other laser that I talked about, which is being used in cataract, that is a femtosecond laser, that is being used to make a flap. Because it's a disruptive laser and it can cleave planes. So instead of using a blade, you have become all the more controlled. And the side effects or the complication rate which could have been there with a blade have significantly dissipated or gone off when you are using a femto laser. It's a very forgiving laser. So the flap is now made with a femto laser and you are reshaping the cornea with the excimer laser. Now next step. Instead of burning the corneal tissue, you are using the same femtosecond to move it in two planes. This plane, and you are, supposing I had to burn this much of cornea. Instead of that, I have a loaf of bread. I put it, slice it, and pick out a slice. Okay, that's called as a lenticule. So you use the femtosecond to create a slice in the cornea and through a small incision. Earlier the incision was bigger, so through a small incision you would take out the lenticule. Okay, so that is called as a flapless procedure. So this is called as a lenticular extraction. Again, we have been pioneers. We brought in the lenticular extraction in India, which was earlier called as SMILE. Different machine I worked. First procedure globally we did, that is called as the silk procedure. That is by another company, the machine. So you are now having these three methodologies for removing glasses: LASIK, femto LASIK, and lenticule extraction.
Okay. Lenticular extraction is SMILE.
Yeah, SMILE or silk.
Okay.
Okay, there are four companies that are SMILE, Silk, Clear, and then there is another one which is called as ATOS. So there are four companies which are doing the lenticular extraction. But the key area is that you are reshaping the cornea. Okay, you are not burning tissue, but you are making a lenticule and pulling it out. So Silk has certain advantages over SMILE. SMILE was the first one. They have certain advantages. Now the new machines have come. So this again is a particular way that is there.
So I'm so sorry to interrupt. I'm just going to summarize for the audience.
Yeah.
So for the myopia, we need to reshape the outer surface of the eye, which is cornea.
Yeah. For anything, any refractive
error.
Myopia.
To remove the glasses.
Yes.
To remove the glasses, we need to reshape the surface of the cornea. For that, we are using laser. In that laser, there are multiple techniques that you beautifully explained.
Yes.
And out of that, there are four methods: LASIK, lenticular extraction, which comes under SMILE, Silk, and other things, and then femto LASIK.
Femto LASIK, and then there is a fourth technique which is called as SmartSurf.
SmartSurf.
Okay. So that technique is that if the cornea, see what happens is that when you are making a flap and you are burning tissue, so you are weakening the cornea by two things. One is, even though flap sticking back, but it does not contribute to the strength of the cornea post-operatively or post-LASIK. And the second is amount of the tissue that you have removed. Now, there is a limit to do that. There are certain tests that you have to do. That's what I did mention, that you have to be fit for getting it done. So we have to look whether there are signs of your cornea being weak and not being able to withstand the laser. In those cases, we do the additive surgery, that is the implantable lens. You don't take away any part of the cornea, but rather you put in a lens which is there. So again, the parameters of the eye have to be such so that the lens can sit within the eye without causing complications. So one thing is, again, there is a lot of science, there is a lot of art that goes into deciding what
Surgery.
suitable procedure has to be done for your eye.
Got it.
So people have again trivialized it. There is the lot of it's some people just say that they bought a new machine. They will just talk about that machine that, well, that gives you a supervision, this, that, and the other. We started talking about supervision in the year 2000. That's 25 years ago. So it's again new
back.
bottles, old wine, etc., etc. And another company has come out. They are talking about something that, well, there is eyes and it gives you supervision, etc., etc. You have to believe in the doctor making the right choice and the doctor having a handle on almost all types of equipments. People just have one equipment and they will. So basically, you have to be a refractive surgeon. It's a refractive surgery is again a separate subsection where you have to be able to do good and also take care of if at all there are any complications and decide as to which procedure has to be done. Now, when I was talking about the weakening of the cornea, if you take away the flap and do the laser right on the surface of the cornea, then you are saving the thickness of the flap. So you burn the epithelium, like on the skin you have epithelium. Similarly, the cornea, the outermost layer of the cornea is the epithelium. So you burn it with the laser only after measuring how thick the epithelium is, and then continue with the excimer laser to reshape the cornea. The patient has pain and discomfort till such time that the epithelium regrows. So it's like if you have scratched your cornea, so you have pain, watering, discomfort, etc. So we put a bandage contact lens, a lens which works like a bandage, till the epithelium grows back. So this is done for thin corneas. Okay, so this is where the different types are. So you can start by doing a laser on the surface, which is called as a surface ablation or SmartSurf. You can do a blade LASIK, where the flap is made by a blade. You can do a Femto LASIK, where the flap is made by a femto laser. And you can do what is called as a lenticular extraction, where you're making a lenticule by the femto laser only. So these are the type of laser procedures. These we group under laser vision correction. The second is a lens-based procedures. So lens-based procedures are where you are implanting a lens, or what is now with the confidence level having gone so high, like in a cataract surgery, and the quality of the intraocular lenses having improved with the EDOF lenses, etc., that we can do even a refractive lens exchange. That means if a patient is not fit for a ICL, you can actually take away the lens without the person even having cataract and replace it by a lens. So you have a presbyopic lens exchange. That means what I told you, presbyopia. You have presbyopia. I can remove your lens and put in a new lens so that your need for glasses for distance and near both go away.
Follow Center for Sight and post your queries to get answers from the experts.